Good afternoon. We'll get started with today's briefing. Today's briefing agenda will look slightly different. First, we'll hear situational updates from Mayor Tom Barrett, Dr. Ben Weston, Director of Medical Services of the Office of Emergency Management, and Darren Rausch, Health Officer and Director for Greenfield Health Department. Then we'll move into answering some questions from our community members submitted via social media. And we'll conclude today's briefing hearing questions from the media that have joined today. So thank you all, and we'll start the agenda off with Mayor Tom Barrett.
Well, thank you very much, Catherine. And I think most of us recognize that it was exactly 5 months ago today, Friday, March 13th, when we had our first diagnosis of a COVID positive case here in the city of Milwaukee. And the world has changed dramatically here and throughout this nation and throughout this world over the last 5 months. But we continue to persevere and to work with our partners at the county, at the state, and others, particularly in the medical community, to do everything we can to reduce all of the pressures that are placed on our systems, whether they're our economic systems, our educational systems, our nursing systems, to deal with this incredibly difficult issue. But I am pleased because as we watch these numbers and as we look at the key indicators, I'm very pleased to see that our key indicators continue to hold steady with 2 greens. And remember, we've got the green, the yellow, and the red, and the greens are the place where we want to be. So of the 5 indicators, 2 of them are now green, and those are for testing and care. And the other 3 are all in the yellow area for cases, safety, and tracing. So we are no longer in the red area for any of the 5 indicators, which is a good sign. Another key indicator for what we are looking at in the hopes that we can be on the road to normalcy, the road to recovery, is the positivity rate. And as some of you may remember, when you look at the positivity rate, that means of the people who take the test, what percentage of them test positive. And we were well north of 10% at one point. Some states have barred us because we have been north of 10%. There was a point where, and I think Illinois and Chicago might be allowing us to be reversed in terms of their indicators because of where we are now. But last week, our positivity rate was 7.7%, and this week it's 7.2%. That's the kind of progress that we want to see, that we all want to see. We want to see that positivity number continue to drop. So to have it drop from 7.7 to 7.2, I think is significant. And I think that the continuing positive decline in COVID-19 cases here in the city of Milwaukee is because of the widespread mask usage. The widespread mask usage is working. And I love to take walks. And I don't, when I leave the house and I'm running into people, I'm going to have the mask on. It doesn't mean if you're going to be by yourself in your yard or you're walking by yourself that you have to have the mask, although it doesn't hurt and it's good to have it on at all times. But whenever you're going to have that interaction with other people, it is imperative that you have that mask on. That means if you're going into establishments, if you're stopping to talk to a group of people, that's when you need to have the mask on. And I think what we're seeing widespread acceptance of this. In fact, there was some polling that was done. It was released by Marquette University. And within the city of Milwaukee, there's 83% support for the mask usage. I think that is as a result of the recognition that the mask policy is indeed working. And so we want to continue that. We want people to understand it as to why we're doing this. The other component of this, which is very, very important, as we've been saying for several months now, is the tracing. And our contact tracing efforts continue to improve, with now 83.9% of COVID positive residents successfully reached within 3 contact attempts. So what happens is when an individual is tested, if they test positive, they are at first contacted by the health department. They are asked who their contacts are. Then the health department, sometimes in conjunction with other health departments, sometimes in conjunction with the state, will try to reach those contacts. And the fact that we're reaching nearly 84% of individuals is a very, very important step in controlling the spread of this disease. So all the science points to masks as the best way to help stop the spread of COVID-19. And this will certainly remain true as we continue to fight the pandemic moving forward. Tuesday was election day. And we were very happy to see that a vast majority of our voters did wear their masks to the polls on Tuesday. Only a few voters refused to do so, and they were asked to vote at the entrance, asked politely to vote at the entrance. So I want to thank everyone who wears a mask in public, at the polls, at the grocery store, in a restaurant, or in a workplace. Wearing a mask protects your health, the health of others, and it shows consideration and respect for the lives of everyone in our community. And I want to highlight that word respect. This is about respecting other people in our community. We are a community. We want to respect each other because we're all in this together. And it's on us to hold ourselves and others accountable. So the work is going to continue, and I appreciate the cooperation we're seeing and everyone's efforts to keep our community safe. One other point I want to make on testing is I cannot stress enough the benefit of getting tested if you are an essential worker, if you live in an area with high rates of COVID-19, or even if you find yourself to be symptomatic. That is key as well. Our National Guard testing sites continue to perform incredible work. And I want to once again thank our National Guard for the work they're doing. But as of Wednesday, August 12th, just yesterday, at the UMO site on South Chase, they tested 1,080 individuals. At Custer High School, Obama on the north side, they tested 528. This week alone, we've tested over 4,700 people at those sites. So testing is available. It's available for all, unlike some other parts of the country. Here in Milwaukee, we continue to have readily accessible testing where you'll get your results very, very quickly. And it is very vital that we continue to test and track the spread of COVID-19 in Milwaukee to take the necessary steps to keep our residents safe. One other point, I heard some back channel stories about individuals in workplaces who were being asked to sign waivers that they won't hold the employer responsible if they test positive for COVID-19. I contacted our city attorney's office, and he said, and she said, that workplace injuries and workplace illnesses are going to be covered by workman's comp. So those would not be valid, but I caution our employers not to take advantage of employees in this very, very difficult situation. So with all of that, I want to turn it over to Dr. Weston, who continues to do a great job providing us with incredibly important information and presenting it in a way that all of us, even those of us who are not statisticians or mathematicians or doctors, can understand. So Dr. Weston, the floor is yours.
Thank you, Mr. Mayor. I appreciate that. Good afternoon. So first, as always, to our numbers, we have 21,748 individuals who've tested positive for COVID-19 in our community and 394 who've died. Real quick, on the last briefing, I misspoke one of the digits in my total number of cases. This was rapidly pointed out to me, so apologies for that. But the number today is accurate, 21,748 cases. So I'll be fairly brief here, leave some time for the questions from social media afterwards. Overall, we continue to see stability in our percent positivity in our county. We updated our key indicators today. While there's a slight downtrend in our percent positive, it doesn't meet that statistical significance to change our indicator. But nonetheless, this is promising news for our community. While we know that this is certainly in the background of less positive news, our state hitting the grim landmark of 1,000 deaths, and the country hitting a daily death count higher than we've seen in months. That is to say, we must be cautious in our optimism. But the work that the county, the city, the municipalities are doing to slow the spread of disease, and of course, as discussed by the mayor, the work that individuals are doing in wearing masks, in physical distancing, and really changing their day-to-day habits is to be applauded. We are seeing, as mentioned, testing numbers that are slipping a bit, that are going downward. We want to specifically encourage anyone with symptoms of COVID-19, any symptoms of COVID-19 to get tested. And get tested as soon as possible once you have symptoms, and isolate yourself from others. And this really helps to minimize any spread of disease. So whether or not you have a healthcare provider, whether you have insurance, income, and no matter your immigration status, you can get connected with a test and a testing site by calling 211. I'll stop there. Thank you, and stay safe.
Thank you, Dr. Weston. And now we'll hear from Director Rausch.
Good afternoon, everyone. My name is Darren Rausch from the Greenfield Health Department. It's my pleasure to join today to give you a little bit of a data snapshot looking at COVID-19 in our communities. I'll go ahead and share my screen here. And what I've done today for this brief update on the data, I've put the children's report on the left and the report for all COVID in Milwaukee County on the right. So children aged 5 through 17, those are our school children, and then all residents of Milwaukee County on the right. I just wanted to kind of underscore what I stated last week, is that the trends among kids were very flat during the safer at home period and didn't start increasing until the early part of May and mid-May when safer at home was lifted. But we see very similar trends on the left in the school children as we do on the right. We see peaks in mid-May and again in July for the city of Milwaukee when we look at the 7-day averages. And we see a very pronounced peak in both the kids and the all population graphs when we look at the suburban communities. So the suburban communities, as I've mentioned in the past, have had a lot of disease since July 1st, and that trend continues to hold pretty steady, but on a little bit of a downward trajectory. So the rest of my time here, I'll just hit some highlights from the all county report. As we have mentioned in the past, deaths remain pretty stable throughout Milwaukee County. Over the last month and a half, the deaths have stayed on the low end, but very stable and very consistent. Our growth rates have increased a little bit. Currently in Milwaukee County, our doubling rate is about 60 days. That's an increase of 5 days from last week's report. We've tracked the reproductive number, as you all know, for many weeks. The reproductive number of 1 means that for every positive individual with COVID, they may infect another additional person. That transmission rate has been below 1 in Milwaukee County for the last couple weeks. That's very good. And then when we look at trends between the city and the suburban communities, we see that they have fluctuated a little bit. Currently, the suburban communities look like they're in a downward trend for transmission rate. In Milwaukee as a city, that data looks pretty stable, but again, below 1, which is where we'd like to see it. We've tracked a bunch of demographics over the last several weeks and months as we've shared data with you. I will continue to highlight that the trends that we've talked about over the last several weeks continue. Our 18 to 39-year-old population has the highest number of cases in Milwaukee County, and they have the highest rate of disease in Milwaukee County. In fact, just this week, the rate of disease amongst those individuals between 18 and 39 and those individuals that are between 40 and 59 has surpassed the rate of our oldest population, those who are 80 plus, which really just underscores that a lot of the disease recently over the last month has been happening and occurring in younger populations throughout Milwaukee County. We've seen similar trends in race and ethnicity. Those trends maintain. The Hispanic population continues to have the most cases, and they continue to have rates that are double that of the Asian and Black or African American subpopulations in Milwaukee County. So those are trends we still carefully want to watch. As Dr. Weston mentioned, we are seeing and we have been experiencing a decrease in our testing rates. So when we look at testing data here, we are now 5 consecutive weeks trending downward in overall testing. It's great to see that our percent positive has been inching down as well, but we really want to stress to people that we have testing capability and the ability to get tests throughout Milwaukee County. And we really urge all of you, if you have symptoms, to get tested. If you have concerns about having COVID, please get tested. Our 14-day trend has been pretty stable here. There's no fluctuations over the last 14 days. And that begets the yellow as far as one of those gating criteria that Mayor Barrett had mentioned previously. Lastly, I'll leave you with our spatial maps. When we look over the course of COVID, the red spots on this map are those points where we have had high levels of COVID activity. And then when we drill down a little bit more specifically, we see that within the last week, the areas that are highlighted red here have had a lot of COVID activity. In previous weeks, it always looked like any of the suburban communities in the south side of Milwaukee, anything south of I-94 had a lot of disease. certainly this week we're seeing a little bit more activity COVID-wise in Northwest Milwaukee. So we want to certainly pay very close attention to the northwest side of Milwaukee, the south side of Milwaukee, the southern and southeastern suburbs. COVID continues to occur in our community, and the map certainly identifies where some of our hot points have been in the last week. With that, I'll end and I'll turn it back over to Catherine so we can get to questions from the audience. Thank you very much.
Thank you, Darren. And as you said, now we'll move into the second portion of today's briefing, which is responding to some questions we've received on social media. So primarily we'll be hearing from our health experts. And the first question is directed to Darren and Dr. Weston. It says, should there be a greater focus on informing the public about taking care of their health and getting adequate amounts of vitamin D, vitamin C, zinc, magnesium, along with proper water, rest, and exercise? And is it true to say that these healthy habits can actually help your body better fight COVID-19?
Yeah, so I'll take an initial stab at this. It's an important question, and I think it's a good point. There's no doubt that maintaining a healthy lifestyle allows you to better fight off many diseases, medical ailments, even certain traumas. So this includes a healthy diet, regular exercise, stable mental health. I'm not going to tread deeply into the waters of what a healthy diet entails. I don't think anyone quite has the market cornered on the one best, healthiest diet, but it's fair to say lower sugar, lower salt, moderation of certain types of fat is important. As for the discussion of fighting off or preventing COVID-19 with certain types of vitamins, supplements, acidic diets, alkaline diets, there's no evidence to support that approach. And in some cases, such as unproven or potentially dangerous medications, can certainly be recommended against. So overall, I would say yes, general health is important without a doubt to preventing and fighting any infection, but I would generally support an evidence-based approach to that.
Yeah, I would agree with everything Dr. Weston said about general health. I think the other thing to consider here is that we haven't given up on COVID, nor will we give up on COVID. We still believe that we can continue to fight COVID disease through aggressive testing, case finding, identification of those who are positive, contact tracing, and using the public health tools of isolation and quarantine. So those continue to be the tools in our toolbox, and we'll continue to use all of those. So we want to stress not only, being healthy, but other personal choices that you can make to continue to keep yourself healthy in the face of COVID-19, and certainly as we get into flu season and other respiratory viruses later this fall.
Thank you both. Our next question is for Director Rausch. And the community member is asking, how long are people contagious for? And is that contagious period different for individuals who are asymptomatic?
Right, good question. Individuals who have COVID-19 are largely isolated from others to prevent the spread of disease for 10 days plus 24 hours where their symptoms are improving. So generally we can look at that isolation period as 10 days plus 1 is how we operationalize it. So if Catherine was to come down with COVID today, and we'll use you as an example because you're on the screen in front of me, Catherine would be isolated for 10 days. So we would deem her infectious period where we want to keep her away from others for 10 days plus an additional day. Now, it's interesting and problematic when we talk about asymptomatic individuals because they don't have a clear date of onset. So it is a little bit more difficult in those situations, and there's certain assumptions that we have to make about when they became symptomatic. Generally speaking, for those individuals who are asymptomatic, we use the date they tested as their first date, and we count the 10 days plus 1 from that date of testing. So there is a little variation, and I can understand that's a bit confusing. Believe me, it's also confusing to our staff as well, but one of the key things is that we just have to look at each person's individual situation a little bit to determine when that onset of symptoms started, or in the case of an asymptomatic individual, when they got tested, and we go from there. So there is a little bit of variation in there in cases where they're asymptomatic.
Our next question is for Dr. Weston. Are people being marked as COVID death on death certificates without a positive lab test that shows the presence of the coronavirus? And what percentage of COVID deaths in Milwaukee County never had a positive lab test obtained?
Yeah, thanks for the question. So this is a question that seems to come up a lot, I think, to make sure that we have an accurate count of COVID-related deaths. And without a doubt, it's a critical number to have right. So in Milwaukee County, the medical examiner's office works diligently to ensure that really any death, every single death marked as COVID death, is just that. So these are the deaths that are reflected on our county dashboard. And 100% of those deaths that are considered as COVID deaths are lab tested and lab confirmed for COVID. Now, on top of that, the chief medical examiner, who himself in Milwaukee County is a forensic pathologist physician, he reviews the specific circumstances of each case, each individual case, and at times actually removes them from the COVID death category for those that incidentally had COVID but didn't appear to have that as their actual cause of death. So, for example, you might have somebody who has cancer, they're in hospice, they're doing end-of-life care, they test the whole facility for COVID, that person ends up having a positive COVID test, and subsequently dies. They had no symptoms of COVID, they died as a result of complications of their cancer. That would be pulled out of that group. That's not considered a COVID death, even if they had a positive test. So the medical examiner is very good at making sure that these are true COVID tests, true COVID deaths, and have positive COVID tests.
Thank you. Director Rausch, can you discuss the science behind wearing a mask?
Yeah, again, a very important question. And the science behind wearing a mask for the general public is something that has moved as we've followed this pandemic over the last 6 months. In the early months of the pandemic, you heard myself, you heard Dr. Weston, you heard others, both locally and nationally, say, don't stockpile masks, don't wear masks. We need those masks for our healthcare workers. And that's right, and that still maintains true today. We want to preserve N95 masks and surgical masks for our healthcare workers. Those are the most effective masks, and they are required in those settings. So we want to make sure that the healthcare individuals have masks that are suitable to their exposure. Now, the science on the masks that many of us are wearing in the community, the cloth masks, one like I will demonstrate right here, this lovely Greenfield Health Department mask. These are cloth masks. There is some variability to how well some of them work, and a lot of that effectiveness depends on how well people are wearing them. We have said before on these media briefings, the mask should be at least 2 to 3 layers. It should be of a certain type of fabric. It should cover the nose and the mouth, not just the chin, not just down here on your neck. We need to make sure we're wearing these masks appropriately. These masks are not going to be as good as the N95 masks and the surgical mask. I will not dispute that at all. But the importance of these masks is to help prevent me from transmitting any potential respiratory droplets that may contain COVID-19 to you if we were having a close conversation in an enclosed room, outside, within 6 feet. Similarly, it protects me from you if you are wearing a mask. So there's a lot of science out there that's trying to figure out how effective these masks are, and they're trying to do studies purporting that these masks are inferior to other masks. And yes, they are going to be inferior to medical grade masks. They will be, but they are better than zero. And I've seen data that has showed their effectiveness anywhere ranging from 30 to 40% up to 80%. And with a disease like COVID, if we can do anything that keeps us more safe, we definitely should be wearing these masks. So everybody, make sure you're wearing one of these, state mandate or not, when you're in enclosed areas, when you're within people, when you're with people within 6 feet where it's hard to maintain physical distancing.
And our final community question goes to Dr. Weston. What coronavirus test kits are being used? And do these test kits show positive results only for the SARS-CoV-2 virus? Or do these tests for other coronaviruses as well? And what is the false positive rate of these test kits?
All right, another good question. So there's a variety of test kits out there. For the most commonly used PCR, which stands for polymerase chain reaction, for those tests in Milwaukee County, and that's the typical test, they detect the genetic material from the virus, from a nasal or nasopharyngeal, your nose and your throat swab. They're very specific to that SARS-CoV-2, the virus that causes COVID-19. So in fact, with these tests, the labs typically go a step further. And so they ensure there's no cross-reactivity to other viruses, the flu, the common cold viruses, even some bacterias. So there's also, though, an important distinguish is the rapid test. So the rapid tests result in just a few minutes. These are also quite accurate, but they don't include that cross-reactivity testing with other viruses. So that's why a lot of times when you get a positive test from the rapid test, then they back it up with a second test that takes longer by that PCR method. So generally speaking, there's variability in the different types of tests, the different types of assays that they're using in these labs. But the false positive rates for the PCR tests is extremely low. And there's no reason to think that should any substantial way affect our understanding of the burden of disease in the community. Thanks.
Thank you. And now we'll move to our questions from media. Our first question is for Mayor Barrett, and it comes from Allison Durr with the Milwaukee Journal-Sentinel. She asks, can you clarify what you mean when you say that voters on Tuesday who refused to wear a mask were asked to vote at the entrance? Did election workers bring the poll book and a ballot to the door? And do you have a sense for the tenor of those interactions? What does this say about the city, what the city may see in November when turnout is expected to be much higher?
Well, let me go to the tenor of those conversations to begin with. It's my understanding that there were 2 instances of voters who refused to wear a mask and then complained that they had to vote at the entrance. Both voters were still allowed to feed their own ballots into the machine, but not surprisingly, what the election workers as well as the health department representatives were trying to do was to limit the exposure and the amount of time spent inside of the polling place by individuals who refused to wear a mask. So again, two complaints that I heard of secondhand. I know that our election director is going to be sending out a survey to chiefs, and this will actually be one of the questions that is asked. What kind of interactions have there been? But it's my understanding that they got them the information that they needed to vote. They then processed the vote for them. So what does it say for November? Again, I'm hoping that November will be a much different world from what it is right now. But I think a lot of it's going to be dependent upon where we are in this pandemic. If it's as serious now or if it gets more serious, I think that there's going to be more attention that's going to be paid to masks. If hopefully we see the numbers go dramatically in the other direction, it'll be a non-issue. But as for now, we're preparing to make sure that we are coupling our health department with our election commission for the November election, because we know that that is going to be a dramatically higher turnout. I will say that what we have seen is, of course, a dramatic increase in the number of people who are voting absentee. That, coupled with our ability to have the time to plan and get the election workers, is what allowed us to have 168 polling places open. And it's my hope that none of them are busy on election day, because so many individuals had voted prior to the election day through the absentee process. So again, we continue to monitor it. We continue to work to get more election workers. And I think the best thing I can say is that we got through this August election in a much calmer way than we did through the April election.
Mayor Barrett, the next question is for you as well. It comes from Caroline Reinwald with WISN 12. And she asks, if COVID is covered by workmen's compensation, is it futile for employers to have their employees sign waivers if they get COVID-19 at work? And if so, what protections do employers have?
Well, let me clarify my statement. I did not say that COVID was covered by workman's comp. I said that what we have is a situation where if someone is injured or sick at work, you've got workman's comp. What I'm going to need to do, because this issue has just come up to me in the last 24 hours, is to have much greater and much more in-depth conversations with our city attorney to see what is the validity or the non-validity of those waivers that individuals are being asked to sign. But I think that this is an issue that needs to be explored because in particular, and I'll just use the education setting, if we are going to be having kids back in school, if we're asking teachers to spend 6-7 hours in a day with them and the teachers get sick, I don't want them to be in a situation where they're on their own because they acted responsibly. So I think this issue is going to be an issue that's going to grow locally as well as nationally. And I want to get more information so that I'm not giving bad information, but I wanted to raise that as a concern. That's why I mentioned it.
Thank you, Mayor. The next question is for Dr. Weston and Director Rausch, and it comes from Mark Stevens with CBS 58. He says, on a national media call today, HHS stressed not everyone should get tested. Can you clarify who should get tested in the county?
Sure. So, I'd say in a perfect world, we'd all get tested regularly by an effective, rapid, non-invasive test. And maybe in the future we'll see something like this, but we're certainly not there yet. And that's not locally that we're not there yet. That's a national issue that we as a country are certainly not there yet. And most of the rest of the world isn't there yet. So we certainly don't have the test supply and processing shortages that we saw months ago toward the beginning of the pandemic. But likewise, we don't have an unlimited testing capacity as a country. And that testing capacity goes from the supplies to collect the test, the reagents to store the tests, the lab processing capabilities, the tracing capabilities. There's a whole continuum that goes on there. So going into the fall season, we may very well need to consider prioritizing our testing. It's of course most critical for those with symptoms, particularly those who are hospitalized in a healthcare setting to get tested. And then we have those who have known contact with someone with COVID-19. So I think the intent of that call and the intent of that statement was that we have to start thinking in those terms. And how can we prioritize testing based on the capacity we have to make sure that we're testing the right people in the most efficient manner.
We have another testing question, and Mayor Barrett, maybe you can take a first crack and our health experts can jump in with additional detail. It comes from Caroline Reinwald with WISN 12, and she says, the Milwaukee Health Department issued new guidelines for schools opening for in-person classes this fall. Specifically, if there is a breakout, where can schools send school populations to get tested if the school won't pay for tests themselves? And are there enough testing supplies in our community to test entire school populations?
Well, that testing requirement kicks in, it's my understanding, if there are 2 positive cases in the cohort. And what that means at that point is the school has a decision to make. It can either, in essence, go to virtual at that point, or it can do the testing. That testing, it's my understanding, would be something that would be their responsibility. So I think that that's going to be part of the conversation. But clearly, what you have to do, and this is part of the directive, is to contact the health department, and they'll be able to walk the individual school through what the next steps are. But with one individual testing positive, they are required to contact the Milwaukee Health Department. With 2, then you go to a higher level, again, which there's sort of a fork in the road. You can either take the steps in conjunction with the health department to limit the exposure by limiting the physical presence, or you can go the route of testing. I think that is going to be an issue for those schools that don't want to do it, but they're going to have to work with the health department to figure out how that's going to be done. It's not my understanding that the health department has agreed to pay for that. Now, we do have the community testing sites, so that might be something, but I would strongly urge schools to contact the health department to get a more concrete answer for that.
I would just say one other point to emphasize, as the mayor did, is that cohorting concept. And so if you have a school of 400 kids, the hope is that school is being structured in such a way that all 400 of those kids are not in the whatever auditorium, cafeteria, whatever it is, together at the same time. So they're cohorted, they're separated out into the classroom. So yes, if 2 kids test positive, maybe those 20 kids in the classroom, you need to figure out how best to test them. But hopefully it's not the 400 kids that they just sat in the auditorium with.
That's a good point. What I'm seeing is our final question from media is from Tim Betcher with TMJ4. And he says, Mayor Tom Barrett, what is your response to the DNC asking participants to take a pledge to avoid bars and restaurants due to COVID-19?
Well, I can tell you, I would consider myself a participant in the DNC. I am the co-chair of the host committee. I am one of the permanent co-chairs of the convention. I'm a delegate to the convention. No one has asked me to sign any pledge about not going in any bars. So I personally think this is one of the biggest non-issues that we faced in the last week. We got a lot of real issues. This one's pretty much a non-issue. It's my understanding that somebody said, look, if you're going into a bar and restaurant, if you cannot socially distance, don't go in there. Well, we say that to everybody. That's not limited to people who are here for the convention. I'll say it again. If you are going into a restaurant or a bar and you cannot maintain that 6-foot social distance, don't go in there. That's the whole point. That's the whole point of what we're trying to do. So I think somebody was looking for a story. They've got a story. And the other part that makes it a non-issue is there are no delegates coming. There are virtually no speakers from outside of Milwaukee coming to the event. So this directive, if it was a directive or if this pledge, I don't know who it was directed to. So again, we got a lot of issues to deal with, and I'm happy to deal with those issues as well.
Thank you, Mayor Barrett. Those are all the questions for today. So thank you all. Thank you to the community members that submitted questions. We appreciate it, and we'll hope to continue to do that in the coming weeks. And with that, concludes our briefing for today.
Thank you very much, Catherine.
Thank you.
Thank you.